what is the most likely outcome for the new normal?
I think the new normal is going to depend on where you are and what the risk tolerance is for the population. What we know is that COVID-19 cases are always going to occur. There's going to be a baseline number of cases, hospitalizations, and deaths. And how normal a place will be is probably going to reflect not only the risk tolerance of the population, but the availability of vaccines, monoclonal antibodies, antivirals, rapid tests. And I think for most of the Western world, 2022 will probably be the last year of the pandemic when we look at it historically in terms of the acute phase. But for the rest of the world, I think you're still going to see flares and concerns about hospital capacity and access to medical countermeasures probably well into 2023. But I think most people in the Western world or your viewing audience are likely to feel this be as similar to 2019 as it's ever going to get.
And Sam, just on the heels of what Dr. Adalja just said, can you talk about sort of the global outlook and what this means for more developed countries?
Yeah, so what I'll do is perhaps refer to the emerging immunology that we're seeing with regards to an Omicron infection, which clearly is obviously the latest wave that's taking over, having had Delta and then prior to that, either Alpha or Beta, depending where you are. What is emerging is that, at least in one paper that I've seen, that if you are unvaccinated and you get Omicron infection, the level of antibodies against Omicron are obviously quite high in terms of neutralizing antibodies, etc. But those infections don't give you protection against other variants. And they tested in that particular setting, which was a study from South Africa, the Beta variant and the Delta variant and a couple of others. So what that says is that, as Dr. Adalja was just saying, is that it depends where you're from. If you're from a country where vaccination levels aren't very high, where we've seen data, again, very recently, that an Omicron infection on top of a vaccination gives you a very broad immune response, even after just 2 doses. If you don't have a good background of vaccinations and you're relying on infection-induced immunity to help you, Omicron's not going to be the ticket out of that particular problem. And therefore, the inequality in terms of how the pandemic evolves is going to be exacerbated if this Omicron data pans out to be correct.
You know, I think about 6 months ago when there was this great conversation around if the world isn't vaccinated, if people are not healing around the world, then this is likely to create new variants and spread even faster. Dr. Adalja, I'm wondering how an unequal recovery when it comes to COVID around the world may impact the course of this disease ultimately in the way we look at it now.
What will likely happen is that you will have parts of the world in which the virus is spreading unchecked, places where there's not enough population immunity. And that's going to give the virus the ability to evolve, to create new variants. And I think that's why the key thing has to be getting first and second doses into the populations of the world if we're going to really make COVID-19 not a threat. And we still have to think about second generation vaccines, like universal vaccines that may be able to be effective against all variants. All of that's going to be really important for this recovery. But the point is that when you're dealing with the pandemic, you have to think about it in every corner of the globe, because every place that it's burning out of control or where it's having the ability to evolve rapidly is going to put other parts of the world in danger. And I think that's something that's lost on a lot of people, where we worry about boosters in the Western world, but much of the other parts of the world are still worrying about first and second doses.
Right. And Sam, I'd love for you to piggyback off of that, and especially too, because some people have talked even about fourth doses for some people in the Western world. Do you anticipate that we'll be talking about fourth doses in the next 6 months?
Yeah, so that's a great question. And I really don't think anyone's got the answer to it. Obviously, the Israelis have gone ahead and done the fourth shots for folks over the age of 60 and have made it available as a guidance as opposed to a rule for others if they want one. And if you look at the take-up, it's not high at all when you compare it to what happened with the third shot. Now, the question here is, we keep seeing emerging data. Just to yesterday, a Nature paper looking at the breadth of the immune response, the quality of the immune response after a third shot in people. Even older people, where you're getting a very good so-called memory response that provides very broad ability to neutralize different variants. And in the case of another paper that I saw from Rockefeller, it actually even showed that you can induce, after a third shot, antibodies that help, and especially in hybrid immunity, one where you have been vaccinated and then infected, antibodies that even neutralize the early 2000 SARS-CoV-1 virus. Now, if you think about that, and Dr. Adalja referred to the potential for a more broad vaccine, I wonder whether we're already dealing with vaccines and our immune response that has got us there. So will we need a fourth shot? If we're constantly chasing those increased and boosted antibodies to reduce cases, then I guess that's what the country will have to deal with. If our focus remains disease management, severity of disease management, pressure on healthcare, etc., then I'm not convinced that we need a broad use of fourth shots.
Dr. Adalja, what do you think?
I agree. I think that we have to get clear on what our goals are. If our goals are to prevent serious illness, hospitalization, and death, I don't think there's a broad need for a fourth dose outside of immunocompromised populations. I don't even think there's a need for a broad use of third doses outside of high-risk individuals, people above the age of 65, those with high-risk conditions. Because what we know is that the vaccine, even 2 doses of it, protects against serious illness, hospitalization, and death in most age groups. And I was much more for a targeted booster campaign. And I think this all stems from the fact that we're unclear on what the goal is. Is the goal preventing serious illness and making sure hospital capacity is okay, or is the goal trying to prevent every case? And if that's the situation where we're trying to prevent every case or minimize cases, using these first-generation vaccines, you're always going to be chasing antibody levels because boosters have transient benefit. The antibodies go up and then they go down, and then people become susceptible to infection again. But I think that's what we have to really be clear on, and I don't think that's been articulated well by the administration or the world.
Dr. Adalja, you made this comment a little earlier that for a lot of the developed world that it will feel a lot like 2019. But that implied not completely. So what will be different?
There will always be a COVID-19 risk because the virus is going to be endemic. So it's something that you will have always a non-zero risk that you might get COVID-19, but because you're vaccinated, because you're boosted, because you've got access to antivirals, it's a mild illness, much like every other respiratory virus. There's going to be changes in people's behavior as well. There are going to be some people that have different risk tolerances that may continue to wear masks in crowded congregated places. Others may not. People will also be much more attuned to the changes that have happened in society, more things being online, more people going to Airbnb than going to hotels, more meetings on Zoom than flying to Chicago, for example, for an afternoon meeting and flying back. All of that's going to be different in our society, more streaming, more video games. Pandemics often have cascading impacts on much of society, and society changes. Some of the trends that were already happening in our day-to-day life got accelerated. Telemedicine is another one. There's a lot of differences in the world of 2022 post-pandemic than 2019, but I think we will get back to something that resembles our life.